back at it, continuing my skincare journey with Apex Skin. We are here at their Avon location, which is where I come to get my laser treatments done for my skin. And Dr. Cynthia Henry is the one who does it for me. And we also have certified nurse practitioner Debbie Sorik here as well. Both use lasers on a regular basis, correct?
Yes.
And I have been floored, and I think it is so important for me to be very transparent with this about how much my skin bothered me beforehand with all of my dark spots. And you've seen my before pictures, you've seen the after pictures. For you as a doctor witnessing that, I mean, that seems like a drastic change to me.
Yeah, but that is what we're seeing for a lot of our patients though. People who are very careful about the sun, like yourself, you can have great results.
And I wasn't always careful before, and that is why I think I had a lot of problems. And now it has altered that by doing things like IPL. So when you're doing lasers, what types of lasers are you working with normally?
Well, the one that you've had is the IPL. It's a certain part of the wavelength. It's not technically a laser, but it's people think of it as one. It works on red, it works on brown. We also have the Resurfix, which works on more retexturizing and tightening of the skin.
And I know that, again, I'm just one of many patients that you've seen wonderful success stories with. Can we jump into some of the others that maybe are sticking in your mind that you've seen night and day difference with?
Absolutely, yeah. So we have a patient here, a middle-aged gentleman who had dyspigmentation, a lot of sunspots on his cheeks, and those have been resolved quite nicely with just a few treatments.
Wonderful. And what about redness? It can really combat the redness, then, things like rosacea.
Yes, it works on the fine blood vessels of the skin. It works on any underlying redness of rosacea or flushing. And this, we have a patient who had wonderful success with redness on her cheeks and visible blood vessels that have completely vanished with the treatment.
And the other thing is scarring. And I know that people either have acne scarring or maybe physical scars from surgery. Debbie, you deal a lot with that as well, correct?
I do, and I've had a lot of really good success with our resurfacing laser. Acne scarring is a big issue for a lot of patients, and so our patient here is a young woman who had acne scarring prior to even coming to Apex and meeting us. And we've had some really good results with the Resurfix on that, and she's been very happy. And she's actually only had, I think, 2 treatments at this point, so we'll be working some more with her.
And then if someone has surgical scars from any maybe on different parts of our, not necessarily their face, it works with that too?
It does. So I have actually several patients I'm treating for scarring. One is a surgical scar on the face from a skin cancer that she had. She's a very young girl, and a young woman, I should say. And it helps to rebuild the collagen and kind of fill in some of those indented scars. She's doing really well after 2 or 3 treatments as well.
I don't think people realize unless you go through something, how something like this can bring someone self-confidence back, can bring back something they feel like they've lost in a way. And I think since I've been sharing that I've been getting this laser treatment done, the number one thing people ask me is this safe to be doing? What would be your response to that? I say yes, but I think they need to hear something from you.
Yes, I think as long as they're going to a board-certified physician or nurse practitioner so that they're getting the right valid information, and then that's super important. You don't want to do this in some place that is not having that type of credentialing. The other thing is to remember there are lots of different types of laser treatments or light treatments, and they're not all created equal. So having somebody evaluate you, get the right thing for you is really the most important thing, and that the lasers, you can't say one worked, one didn't. You have to know exactly what you're talking about.
It's amazing. I just can't get over my before and after pictures, and I thank you so much, because I would have never sat here and felt this confident in my skin if it wasn't for what you have done for me. So I appreciate you so much, and thank you guys for what you do here at Apex. We appreciate you.
Thank you, Natalie. Thank you.